Hi, I'm Emma from Digital Doula Mum. Today we're covering week 6 of pregnancy. What's happening with your body and your baby, common symptoms, helpful self-care tips, and when to contact your healthcare provider. Quick note, I'm not a medical professional. This is general information. Check with your midwife or GP for personalized advice. At 6 weeks gestation, about 4 weeks after conception, the embryo is about the size of a sweet pea, roughly 4 to 7 millimeters. Major developments are underway. The neural tube continues forming, the heart is developing and may begin to beat, limb buds and early facial features are appearing, and the placenta and umbilical cord are forming. Let's cover common symptoms you may notice. Fatigue is very common. Rising progesterone and increased metabolic work can leave you exhausted. Nausea and morning sickness can occur any time of day and may be triggered by smells or hormones. It is often most intense during the first trimester, but typically eases as you enter the second. Breast changes, tenderness, swelling, and darker areolas are normal. You may notice more frequent urination from hormonal changes and increased blood flow. Mood swings and emotional sensitivity are common. Hormones and life changes can feel intense. Food aversions, cravings, and a heightened sense of smell are typical. Light spotting or mild cramping can happen. Heavy bleeding is not normal and should be checked. Bloating, gas, and constipation occur for many people as progesterone slows digestion. Increased white vaginal discharge is usually normal unless it is itchy, foul-smelling, or green-gray. This week, the primitive heart may begin to beat and sometimes appears as a flicker on ultrasound. Neural structures are developing rapidly and limb buds are forming into arms and legs. The placenta is taking shape and beginning to support the pregnancy hormonally. About tests and appointments, many people schedule their first prenatal visit around 8 to 10 weeks. If you've had a positive home test, it's common to confirm with your provider. A transvaginal ultrasound between 6 and 9 weeks can confirm pregnancy location, heartbeat, and viability. Your provider may order blood work to check HCG, blood type, and Rh, hemoglobin, and screen for infections. Genetic screening is usually discussed later around 10 to 13 weeks, but you can ask about options early. Self-care. Rest and pace yourself. Short naps of 15-30 minutes can help with extreme tiredness. For nausea, eat small, frequent, bland meals. Keep crackers by the bed. Try ginger or peppermint and sip fluids slowly. Nutrition. Aim for balanced meals with protein, whole grains, fruit, and veg. Start or continue a prenatal vitamin with folic acid if you haven't already. Avoid alcohol and recreational drugs. Limit caffeine per your provider's advice, and avoid smoking and secondhand smoke. Check with your provider or pharmacist before taking OTC meds. Paracetamol is commonly used. NSAIDs are usually avoided unless advised. Gentle exercise like walking or prenatal yoga is usually encouraged. Check with your provider if you have concerns. Normal sexual activity is usually safe unless your provider advises otherwise, especially if you have bleeding or a history of miscarriage. Call your provider or seek urgent care for heavy bleeding, passing tissue, or severe abdominal pain. Also call for fever over 38 degrees Celsius, fainting, severe vomiting, or signs of dehydration. Contact your provider for signs of infection, such as foul-smelling or itchy discharge. Emotional health. It's normal to feel anxious, overwhelmed, or not yet excited. That's okay. Talk with your partner, a friend, or a support group. Consider counseling or prenatal groups if anxiety or low mood persists. Practical next steps. Schedule your first prenatal appointment, start or confirm a prenatal vitamin with folic acid, and keep a simple symptom diary. Pack a small snack and water for low-energy days, and wear comfortable clothing and a supportive bra. Common quick FAQs. You won't feel fetal movement yet. That comes much later. Light spotting can be common, but heavy bleeding needs evaluation. Thanks for watching. If this helped, like and subscribe to Digital Doula Mum. Leave any questions below and take care.